part two with the back. With the wife, when I start taking any type of medication, I tell the wife, I want you to let me know if you see a change in me. All right? Which she would do anyway, but we're talking about it, we discuss it. Now, because I get stubborn at times, oh, yeah, right, yeah, you're right, dear, yeah, you know, that type of thing. We wrote out a small contract between us. Plain and simple. You know, not therefore as and all that crap. You know, just plain and simple that I agree that if she says there's something wrong that I should do or cut back or whatever, that bang, I'm going to do it. And we both sign it. Now, because I am a man of my word and I will stick by a contract as a handshake as well, that was something I would always, you know, find bonding. So if she never had to, but if she ever pulled that out, you know, at that point I would say, okay, yeah, I did say it, we did sign it, you know, she's just not, you know, pulling my leg at this point, you know, so at that point that's where it's at. But between her and I, we were able to get me into a decent amount to where it relieves some of the pain, and I can function as a human being. And I went back to work and everything was fine. Now, in the interim of some of this drug changing, he put me on something called a fentanyl patch. I don't remember how to spell it, but it's fentanyl. And it's a patch. You put it on, you know, on your arm or your side, you know, sometimes on your side actually, near your rib, that's the best place for it. And it's good for 2 or 3 days. And it worked. However, this was one of the times where she had to tell me. And I kind of knew, you know, I mean, this was just it. About a month or so in, I really started to feel different. I started to feel more emotional, confused, at times angry. You know, I mean, it was just a ball of different types of emotions. I would wake her up at 2 o'clock in the morning because I'm pacing around saying, babe, we got to go for a ride. Well, where we got to go? I don't know. I just know we have to go someplace. So she would faithfully get up, get dressed, and we'd jump in the truck, and I'd ride around town for 20, 25 minutes. I mean, I knew everything I was doing, you know, and then I said, okay, let's go home. I go home, and, you know, and that's, you know, it was done. You know, and then the next thing you know, an hour or two later, you know, I'm up pacing around again because there's something I'm supposed to be doing, which there really wasn't, but I didn't know. You know, I mean, it really screws with you. So my wife told me, take the patch off. I took the patch off. She stayed up with me this night. You know, I'm falling asleep on the couch because I'm trying to watch TV to keep my mind somewhat active, you know, to keep my mind off of whatever it is I wasn't or supposed to have been doing. Because I'm telling you, I can see how people commit suicide on these things sometimes. You know, but at that point, she stayed on the couch with me, you know, and the patch was off. And the next morning I called the doctor, and, you know, she's still staying with me. And the doctor says, good, I want you to come in now. And I went in, and, you know, he had given me another medication. Apparently it was to help get the other one out of the system. I don't know. And then that's when he put me on this medication, which started working fine. So, but at that point, you know, talk to your wife about it, or whoever you're living with, your companion, whatever, and make sure you have an agreement on it. And don't be stupid and stubborn and not listen, you know, even if you have to write it out. It all depends. Writing it out means nothing if you're not going to remember, be a man of your word. And if you're a man of your word by nature, you're not going to have a problem with understanding the contract you just signed with your spouse. So at that point, do what you got to do and take it easy, you know. But just because they give you X amount doesn't mean that that's where it's going to be. If that X amount takes the pain away, you can still inch yourself off it a little bit to find out if you can actually take less, you know, and still achieve the same thing. And, you know, because again, they don't know. You have to let them know. And the best thing with pain management doctors is to continue to be honest with them. You know, if they catch you screwing up or fucking up or somehow, excuse my language, they will shut you off, and you may not find another pain management doctor. You're going to end up over in the drug rehab pain management instead of over here. So pay attention to this stuff. You know, don't take advantage. Don't screw up. You know, don't lie. Be straight and narrow with them, and they'll be just fine and treat you fine. They're your friend. All right? They're not your supplier. Remember that. Okay, guys. I hope this helps. Catch you later.